So can you give me an overview of the industry size and what are the market dynamics that come into play when we talk about this industry, specifically healthcare?
Yeah, so globally, it's a huge market in orthopedics, approximately of you can say 55 billion US dollars. And India, being a huge country still in orthopedics, we have a lot of scope to grow. At present, like the way we are growing in 2025, we will be at a 2 billion US dollars mark, which is very small as compared to the global market.
Hi, Dr. Pankaj. How are you doing today?
I'm fine, thank you. Thank you so much. Yeah.
Great.
How about you?
So,
Yeah.
yeah, I'm great. So before we start the discussion, I would like to set the context and pace of the session, right? So today we'll be talking about challenges that are faced in orthopedic healthcare ecosystem, right? And today we have Dr. Pankaj, who is an orthopedic surgeon, founder and director at Neemtree Healthcare, right? So before we get into the discussion, right? So I would like to know more about your journey. So if you can shed some light over there, it will be great.
Like being orthopedic surgeon, I have been into practice for almost 17, 18 years now. So in 2019, I realized that there is a huge gap of orthopedic services in tier 2, 3 towns and tier 1 major towns and metropolitan cities. So the patients living in these towns, tier 2 and tier 3, they have to move to bigger towns for advanced surgeries like joint replacements, arthroscopies, and spine surgeries. So seeking that, because definitely when they have to move to bigger towns, it was like the cost was definitely on the higher side. There were logistic issues and they have to move all the way to bigger towns for the surgery as well as for follow-ups. So healthcare infrastructure had developed in these cities. So focusing on that, in 2019, as a pilot project, I started my first center in Panipat. So that's a closer to Delhi. Patients used to move to either Delhi or Chandigarh for these kind of surgeries. So we started in 2019 February, and in 2 to 3 years, in spite of COVID pandemic, the we actually grew there, and our like revenues and number of surgeries had grown year by year there. So seeing that, because we knew it that the requirement is there in these towns for these surgeries. So we started expanding Neemtree in 2020-21, and right now we are in 5 states and 9 cities. Like we are in Haryana, in Panipat, and Karnal. In Rajasthan, we are in Uttarakhand, we are in Roorkee, and in UP, we are in Meerut. So these are the main closer by towns where we have started these centers by Neemtree, and managing the orthopedic services, even advanced orthopedic surgeries like joint replacements, arthroscopies, and spine surgeries. So now, like at all centers, we have been doing well and performing these surgeries as a routine surgery there, with all the backup of specialists as well as the technology there.
Right. That's quite commendable. So when you started in 2019, 2020, it was almost the peak COVID, and I can imagine how difficult it might have been during those times, right? Despite of that, you grew in 5 states and 9 cities, as you mentioned, right? So that's quite commendable, and I believe the ease of surgeries, or you are bringing a doctor nearby to the patients, right, is absolutely amazing.
Absolutely. Yeah. So we are mobilizing skill, the specialists from bigger towns from Delhi to these areas. And actually, it's working very well. They are getting the services at their doorstep in the healthcare infrastructure closer to them. So definitely, it's a big benefit for the patients who need these surgeries. They don't have to move to all the way to bigger towns, and they can get all these surgeries done closer to them.
Correct, correct. That's quite interesting, right? So
Yeah.
before we move into further questions, right? So can you give me an overview of the industry size and what are the market dynamics that come into play when we talk about this industry, specifically healthcare?
Yeah, so globally, it's a huge market in orthopedics, approximately of you can say 55 billion US dollars. And India, being a huge country still in orthopedics, we have a lot of scope to grow. At present, like the way we are growing in 2025, we will be at a 2 billion US dollars mark, which is very small as compared to the global market. So there is a huge scope of orthopedics to grow. And in orthopedics, definitely the emergency trauma fractures are there, which are being handled at every level of hospital and every level of cities, towns in India. But yes, specialized surgeries, they are still limited to metros or bigger towns. So we want to provide these surgeries in each and every area where healthcare infrastructure has reached. Like say now in India, knee replacement surgery, it's a huge market. Like to date, 15% of population in India is suffering from osteoarthritis, right? The which affects the knee joints. And if we talk about the bulk of the patients who need knee replacement, at present, almost 40 million people, they need immediate knee replacement surgery. So this is one segment I am talking about. The same way, hip replacement, spine surgeries, as well as keyhole surgeries. So this is the scenario of orthopedic industry in India at present. Yeah.
Correct. Correct. And how mature do you think is the Indian market when we benchmark it or compare it with, the top five economies of the world?
Yeah. So if you see, now we have very advanced healthcare infrastructure everywhere, right? So the corporatization of healthcare has really changed it. If we see hospitals, the healthcare infrastructure, it is at world class level in most of bigger towns and cities. So we are definitely maturing, and now it's moving towards smaller towns, right? So if we talk about like 10, 15 years back, yes, definitely the this kind of healthcare infrastructure was focused in metros and bigger towns. But now if you go to smaller towns, even the healthcare infrastructure has been really advanced, and the new setups which are coming, they are at world class level. They have modular operation theaters, and yes, uh, we have certain bodies who actually controlling the quality, like NABH. Now, because NABH has been there in smaller towns also, so basic standards in infrastructure, healthcare infrastructure has really improved, which was not there a few years back. So definitely we are heading to a very good future of healthcare infrastructure in India at present.
That's quite interesting, right? So you told that the market is growing, right? So now what are the key driving factors for the healthcare industry in India that are fueling the growth?
So one, we have a huge population, right? The number of population who needs healthcare backup is a major factor which is driving the healthcare industry in India. Then, if you compare, like, uh, I can assure you the quality and the standards of medical training in India, education and training and expertise in India is at par. In fact, it is much better than any of European and US countries. Seriously, the skill is much better. Still, we have very easy accessibility to the medical professionals, right? If you go to other countries, you see in Europe, in US, UK, there is hardly any accessibility to the doctors there so easily. Like if you want to get an appointment for the specialist, you have to wait for days and months, right? But here it's very easily accessible. Then cost effectiveness. Here the treatment is very cost effective. Like we must be the one of the like lowest priced healthcare procedures here in any of the branches, whether it is orthopedics, general surgery, gynae, euro, as compared to rest of the world. So that's a major factor which is driving the industry in India. And then post-operative care, if we talk about like post-operative care, rehabilitation, we have a good manpower to handle it at a very low cost. So it's very easy to provide post-operative home care services to the patients at their doorstep, which is adding to their easing their post-operative recovery and period. So these are the factors which are driving healthcare industry in India to the next level.
Correct, correct, right. So the key pointer over here being that ease of human resources or manpower, right? So that
Yeah,
is something which is playing a major role, I would say, in you know advancing the healthcare industry, correct? Further.
yeah,
Now,
yeah, yeah.
I feel that there are a lot of challenges which are faced by consumers, right? So, if you can highlight in your experience, right, what are the key challenges that the end patient or the consumer is facing?
See, what I see is the main factor is that healthcare services, they are not equally distributed or equally available in all the areas of India. They
Okay,
are concentrated and focused in metros and bigger towns. If you move from any of the metros or bigger town, even 100 kilometers away, there is a huge gap of services in any of the branches, especially the specialized branches like orthopedics, cardio, neuro. Hardly any specialists are available there. The healthcare infrastructure is not to that extent that it should be. So that gap of services is definitely affecting the healthcare services available to the patients at different levels. And that's why it leads to lack of good specialists, good specialized cares in these towns. So I feel that this is a major factor, major challenge to make available at least a basic, a good level of healthcare infrastructure everywhere in India. That's the biggest challenge in there. Yeah.
correct, correct. You rightly mentioned the logistics part is something which is very challenging. India being so densely populated, right? So setting up the centers remotely or in tier two, tier three cities is a really big task in today's scenario, right? And what you are
Yeah.
doing is really commendable, right there.
Absolutely, and I must say that this government, the Ayushman scheme, what they have done is a very uh, positive and biggest step in healthcare. Because of this, like now, the healthcare facilities and all kind of procedures, they are available to the populations, even to the villagers, because they can go to the smaller and closer by towns. So it has made a huge difference in the healthcare services and availability of the treatment in these areas also. Because like in India, hardly any percentage of populations and bigger towns. The majorly and our major population percentage is living in smaller towns as well as in the village areas where this healthcare services they were hardly available. But now, because of this Ayushman scheme, definitely it has helped to make any patient accessible to these services. There's a bigger, huge step which government has taken, and actually commendable and appreciable.
So that brings me to my next question. Like, what is the solution that you are offering and how is it different from other key players or other healthcare providers who are out there in the market?
Yeah, so basically, we are focused in providing orthopedic services, only in orthopedic today. So we are focused to provide orthopedic treatment at par as in metros or bigger towns to tier two and three towns, which at present no healthcare there or no healthcare infrastructure is providing. Second, we are not spending anything we are totally asset light and not spending anything in healthcare infrastructure there. We are utilizing the healthcare infrastructure which are already there and are not being utilized to the optimum level for these services. So we are just mobilizing the skills and technology from bigger towns to these areas where these surgeries can be performed and patients can be benefited with that, taking care of their cost and logistics. So this is what we have been focusing in and focused in mainly orthopedics. So asset light providing orthopedic services in every part we are is our aim, and we have been doing that for past 2 years now, and definitely scaling it up gradually.
Interesting. That's quite interesting, but right. So,
Yeah.
you have been in this industry since past couple of years, right? And there might have been many trends that you have seen, right? So, how has the market evolved over the past couple of years, and what are the trends that you have seen in the market?
So basically, if we talk about orthopedics, in past few years, if I like, I am into practice for past 17, 18 years now. Like I started my practice in 2004, and if I compare orthopedic treatment at that time and to date, there is a lot of difference. At that time, we had limited number of companies and limited number of implants which are to be used in orthopedics. Any implant which used to be launched all over the world, India used to be like whatever product was getting obsolete, that was being launched in India at that time. So many times it had happened. But today, the things have really changed. Any new product, any new research product is launched at the same time in India as worldwide.
Right.
Rather, seeing the huge base of, like we have a huge population, so there's a huge base of patients, seeing the number of patients and the opportunity, a lot of international manufacturers of these implants, they have started moving to India, especially after the pandemic. The Because now these manufacturers are those who want to manufacture out of their countries. They are moving now. They are focusing more in India rather than any other country in Asia, especially like they don't want to move to China now. So we have opportunity to manufacture these kind of implants. So it makes easy availability and definitely controls the cost, because initially we used to import these implants. Now we are getting a lot of manufacturing units, which is definitely reducing the cost here and definitely will affect the affordability to the patient. So this we are heading to.
Correct, correct. Great. So I'm sure that you might have envisaged a couple of things, right? So you're to be state, right? So if I ask you what are your plans, or where do you position the firm in next 2 to 3 years, maybe? So
So we aim to reach in next 3 years to almost every region of India. Right now we are focused in North Delhi and trying to cover most of part of the North Delhi. Right now we have covered 5 states across around Delhi and NCR. We'll be definitely covering few more cities in North India itself, and in next 3 years we'll be moving to other regions and definitely have plans to expand pan India. And this is like we will be creating an affordable ecosystem in orthopedics, in which any strata of patients, they can take advantage of it and can be treated under it without seeing to the cost and without seeing to the affordability.
correct, correct. That's quite interesting aim right there, right?
Yeah.
And so that's about it, Pankaj, from my end for today, right? So it was a lovely discussion. It was a pleasure having you on board and discussing with you, right?
Thank you
So
so much. Thank you so much for having me with you. Thank you. Thanks a lot.
thanks a lot. Thanks a lot. Thank you.